There's Medicaid, known as Badger Care here in Wisconsin. Well, during the pandemic, when people were losing their health insurance coverage left and right, some good people with forethought relaxed the eligibility standards for Medicaid so that more people could get coverage. More people would have health insurance and get things treated and taken care of. But now those eligibility rules were tightened up again. And then there was also the whole notion of not reapplying, but everybody gets re-examined. Like, do you still qualify for Medicaid? And by the way, you tell us, fill out this paperwork in triplicate, and a lot of families weren't filling out that paperwork. And as a result, according to the investigative news site Wisconsin Watch, 360,000 people in Wisconsin have lost their Medicaid coverage at some point over the past year as those eligibility checks resume. Kristen, having 360,000 people kicked off Medicaid Badger Care, even if some of them come back on, but that time when they're not covered, I mean, there's nothing healthy about that.
There's nothing healthy about that. That just is another way that we are abandoning the most vulnerable people in society. And most of these people are women and children and young families who simply can't do without this help, without this little leg up. So I don't get it, Pat. I mean, and this paperwork is complicated. It's hard. They may not know that they need to do it. There are all of these administrative barriers that are preventing them from getting the care that they need. And that's affecting their health, not just now, but for the long term.
So over the past 12 months since verification resumed in Wisconsin, Wisconsin Watch writes, about 30% of everybody that came up for renewal was disenrolled, and about 40% in that group no longer met income requirements or health requirements. But that means nearly 60% lost their coverage, not because they no longer qualified, but because of paperwork issues, procedural issues, and things like that.